I'm Dr. Ben Dodd. Thanks for joining us today. We're going to discuss which weight loss operation you should choose. Now, if you were to consider weight loss surgery in Australia, most Australian surgeons will offer you either a sleeve gastrectomy or one of the two gastric bypass options, those being Roux-en-Y gastric bypass or the newer version of the single limb gastric bypass, otherwise known as a one anastomosis or single anastomosis or mini gastric bypass. But starting with the sleeve gastrectomy, this operation has been around for several decades as a simplification of the more historical and complex bariatric procedures. It is elegant in its simplicity in that the greater curve of the stomach is mobilized and then 85% of the stomach is stapled off from the remaining stomach over a large plastic tube called a bougie. This stomach is then removed. The sleeve gastrectomy is a safe procedure. It gives very good weight loss of usually 65 to 70% at 12 months, though this can of course be more with greater lifestyle factor change. And the weak points of the sleeve gastrectomy, I suppose, are 1 in 5 to 1 in 6 patients can have reflux as a problem long term, and otherwise it is more prone to weight regain than the gastric bypasses. The Roux-en-Y gastric bypass involves partitioning the stomach with a small pouch based at the top of the stomach, and then the small intestine is divided and brought up onto this gastric bypass stomach pouch, but then involves a second join between two pieces of small bowel further down. Now, this is still the gold standard around the world for weight loss surgery, but does have long-term problems. Whilst the weight loss generally is more durable and often a bit greater than for a sleeve gastrectomy, the problems with the Roux-en-Y are that it gives you approximately 1 in 3 patients will have problems with chronic abdominal pain, and whilst these other complications of dumping and small bowel obstruction are rare, if they happen, they can be quite severe for patients and very hard to resolve. Which brings me to the single anastomosis gastric bypass or mini gastric bypass. This operation is quite young in bariatric terms. It's been around for over 25 years with tens of thousands of patients reported in the literature. It's very safe at the time of surgery, being more simple than the Roux-en-Y gastric bypass, but it also gives the same weight loss outcomes as a Roux-en-Y gastric bypass with a much better side effect profile. It does not generally cause chronic abdominal pain. It does not cause dumping or small bowel obstruction, and certainly these potential complications are extremely rare when compared to the Roux-en-Y gastric bypass. In the primary context, as a primary bariatric operation, its reflux outcomes are very similar to a Roux-en-Y long term, meaning vast majority of patients, over 95%, should have no reflux problem long term. In the revisional context, it is a bit more prone to bile reflux, and rather than being a sort of a 2 to 3% risk of reflux long term, in the redo context where the esophageal muscle is weaker, this increases to between 10 and 15%, depending on which source you're reading from. If patients come to me requesting a sleeve gastrectomy, I will discuss with them the options and the 3 reasons I push them towards a gastric bypass if they were preferring a sleeve is if they are trying to lose a very large amount of weight, or if they've already got a heavy comorbidity burden, particularly diabetes, or if they already have significant reflux. So I personally do tend to do about 5 or 6 bypasses for each sleeve, simply because I think they are a better operation for most patients. While sleeve gastrectomy is elegantly simple and does have a role, I think the more modern single limb gastric bypass is extremely safe at the time of surgery with very good weight loss outcomes and a far superior side effect profile long term over the historical Roux-en-Y gastric bypass. I'll look forward to talking this through with you at some point where we can hopefully make a decision about what the operation is that best suits your context. Thank you.